Hey, remember measles, that highly contagious and potentially deadly disease we thought we'd kick to the curb? Yeah, well, it's back. The Pan American Health Organization, PAHO, recently issued an alert about a surge in measles cases in the Americas. We're talking about a disease that can cause serious complications like pneumonia, encephalitis, brain swelling, and even death. The Americas had been free of endemic measles for years thanks to widespread vaccination. But now, thanks to waning vaccination rates and international travel, measles is staging a comeback tour. So buckle up, Buttercup, because we're about to dive into the wonderful world of preventable diseases. Okay, let's get down to brass tacks. As of November 2024, PAHO has reported a significant increase in suspected and confirmed measles cases in the Americas. Brazil, Venezuela, and Colombia have all reported significant numbers. Measles doesn't discriminate based on geography. It's an equal opportunity infector. These numbers should be a wake-up call, folks. We're talking about a potential epidemic. Remember back in 2016 when the Americas celebrated eradicating endemic measles? We had achieved something truly remarkable, eliminating the continuous spread of measles within our borders. But viruses are sneaky. They don't care about our celebrations. Now, instead of homegrown cases, we're seeing a rise in imported cases, carried by unvaccinated travelers. It's like ordering a package online and getting a bonus case of a highly contagious disease for free. Measles is not just a harmless childhood illness. It's highly contagious, lingering in the air for up to 2 hours after an infected person has left the room. Children are most vulnerable to severe complications like pneumonia, encephalitis, blindness, and even death. These are real consequences that can have a devastating impact on children and their families. So, the next time someone tries to tell you that measles is no big deal, just casually show them a picture of a child suffering from measles complications. That should shut them up pretty quickly. Vaccination. It's not just a good idea, it's the law, or at least it should be. Vaccines are the single most effective way to prevent measles, yet vaccination rates in the Americas have been declining. Some of this can be attributed to complacency and misinformation spread by anti-vaccine groups. To achieve herd immunity, we need a vaccination rate of at least 95%. If enough people are vaccinated, they're essentially wearing invisible shields that prevent them from getting tagged. But if too many people are unvaccinated, measles is going to spread like wildfire. PAHO to the rescue again. How to stop measles in its tracks. PAHO has issued recommendations to help countries get a handle on the situation. They're urging countries to strengthen their routine immunization programs and conduct supplemental vaccination campaigns. It's also about communication. Clear, accurate, and culturally sensitive campaigns to combat misinformation. Finally, they're urging countries to strengthen their surveillance systems to quickly identify and respond to measles cases. This means training healthcare workers to recognize the signs and symptoms of measles. Get your shots, spread the word, don't be a host for deadly diseases. This is serious, folks. Measles is a dangerous and highly contagious disease that we thought we'd left behind. The good news is that we know how to stop it. Vaccines are safe, effective, and readily available. So, what can you do? Get vaccinated if you haven't already, and make sure your children are up to date on their vaccinations. Talk to your friends, family, and neighbors about the importance of vaccination. Share accurate information from credible sources. We can beat measles, but it's going to take a collective effort. Let's roll up our sleeves, get our shots, and show measles who's boss.